Male sexual strength is often misunderstood. Many people believe it is only related to age or marriage. Some blame destiny, while others think it is a problem that happens naturally. But science tells a very different story. Modern research confirms that male sexual strength depends on physical health, hormones, brain chemistry, lifestyle, and mental state. When any of these systems are disturbed, sexual performance declines. Today, men in their 20s and 30s report weakness, testosterone levels are falling globally, and erectile problems are appearing earlier than ever. This is not accidental. It is the result of modern habits, diet, stress, and lifestyle. Sexual strength is not a single function. It is a combination of healthy testosterone levels, proper blood circulation, strong nervous system signaling, balanced brain chemistry, psychological confidence, and overall metabolic health. If any of these systems are damaged, sexual strength decreases. The most important hormone behind male strength is testosterone, the primary male sex hormone. It is responsible for sexual desire, erectile function, muscle strength, energy levels, confidence, motivation, and sperm production. According to the Journal of Clinical Endocrinology and Metabolism, testosterone levels in men have been declining steadily over the last 40 years. Men today have 20 to 30% lower testosterone than men of the same age in previous generations. This decline directly affects sexual performance. Low testosterone leads to reduced sexual desire, weak or unstable erections, fatigue, depression, loss of muscle mass, increased belly fat, and poor concentration. A large study published in the New England Journal of Medicine confirmed that men with low testosterone show a significant reduction in sexual activity and performance. What is shocking is that lifestyle habits are silently accelerating this decline. One of the biggest contributors is diet. What a man eats directly affects his hormones. High sugar intake, for example, increases insulin resistance, which suppresses testosterone production. Clinical endocrinology studies show that consuming sugar significantly reduces testosterone levels within 30 minutes, and the effect can last for hours. Processed foods like fast food, packaged snacks, and artificial additives increase inflammation, disrupt hormone signaling, and lower sperm quality. Harvard Medical School reports that men consuming highly processed diets have lower testosterone and poorer sperm health. Even low-fat diets are dangerous, because testosterone is made from cholesterol. Research published in the American Journal of Clinical Nutrition confirms that men consuming healthy fats have higher testosterone levels than those on low-fat diets. Excess body fat is another silent enemy. Fat tissue converts testosterone into estrogen through an enzyme called aromatase. More fat leads to more estrogen and less male strength. The Journal of Obesity found that obese men have significantly lower testosterone and weaker erectile function. Physical inactivity compounds the problem. Sitting for hours, minimal exercise, and sedentary lifestyles reduce blood flow, weaken the heart, and lower testosterone. Research in the European Journal of Applied Physiology shows that men who exercise regularly have better testosterone levels and improved sexual stamina. Chronic stress is another major factor. Stress increases cortisol, the stress hormone, which directly suppresses testosterone production. Chronic stress also damages nerves, reduces libido, and can even cause erectile dysfunction. A study published in Psychoneuroendocrinology found that men with high cortisol levels had 30% lower testosterone than those with lower cortisol. Sleep is equally important. Poor sleep or sleep disorders like sleep apnea drastically reduce testosterone and energy. The Journal of Sleep Research confirms that men who sleep less than 6 hours a night experience significantly reduced testosterone levels and sexual performance. Alcohol consumption is another silent destroyer. Moderate to high alcohol intake damages the liver, reduces testosterone, increases estrogen, and weakens erections. The Alcohol Research Journal reports that men drinking more than 2 drinks per day have up to 20% lower testosterone. Smoking also has a negative impact. Nicotine constricts blood vessels, reduces nitric oxide production, damages sperm, and weakens erections. Studies in andrology show that smokers have higher rates of erectile dysfunction and lower libido than non-smokers. Mental health plays a huge role. Anxiety, depression, and lack of self-confidence reduce sexual performance and desire. Even if hormones are normal, a man under constant mental stress may struggle with erectile issues. Research in the International Journal of Impotence Research shows that psychological stress alone can reduce sexual performance by up to 40%. Pornography addiction is a modern problem silently reducing male sexual strength. Excessive consumption desensitizes the brain's reward system, reduces natural libido, and causes erectile difficulties. Scientific studies published in Behavioral Sciences report that men addicted to pornography have lower sexual satisfaction and weaker erections during real-life intimacy. Certain medications can also harm male strength. Long-term use of steroids, antidepressants, and blood pressure medications can reduce testosterone and libido. The Journal of Sexual Medicine confirms that men on some medications for more than 6 months experience measurable reductions in sexual performance. Age is a natural factor, but modern lifestyle accelerates its effects. Testosterone production naturally declines by 1–2% per year after age 30. However, unhealthy habits like poor diet, stress, lack of exercise, smoking, and alcohol accelerate this decline by decades. Vitamin and mineral deficiencies silently reduce male strength as well. Zinc is essential for testosterone production, and deficiency lowers testosterone levels. Magnesium is crucial for muscle function and energy metabolism, and lack of it leads to fatigue. Vitamin D deficiency has been linked to low testosterone and poor sperm quality. Studies in Nutrients Journal show that correcting deficiencies restores sexual performance in many men. Dehydration is often ignored but has a surprising effect. Proper hydration ensures blood circulation, muscle function, and nervous system signaling, all of which are essential for male strength. Chronic dehydration reduces stamina and energy. Inflammation caused by poor diet, infection, or lifestyle can damage the blood vessels necessary for erections. Men with chronic inflammation have weaker sexual performance and higher rates of erectile dysfunction. According to the American Heart Association, erectile dysfunction is often an early warning sign of cardiovascular problems. High blood pressure, diabetes, and heart disease reduce blood flow to the penis, weakening erections and reducing sexual stamina. Diabetes, in particular, damages nerves and blood vessels, directly reducing male sexual performance. Research in diabetes care shows that men with poorly controlled diabetes have significantly higher rates of erectile dysfunction. Excess caffeine is often overlooked. While moderate caffeine may improve alertness, excessive caffeine causes nervousness, high blood pressure, and disrupted sleep, indirectly reducing testosterone and energy. Environmental toxins such as pesticides, heavy metals, and endocrine disrupting chemicals silently lower testosterone and harm sperm. Studies published in Environmental Health Perspectives show that men exposed to high levels of toxins have lower testosterone and higher estrogen. Sedentary office work is a modern challenge. Sitting for long hours compresses the pelvic region, reduces blood flow, and weakens the muscles necessary for sexual performance. Regular physical activity and pelvic exercises improve strength, stamina, and confidence. In summary, male sexual strength depends on a complex system of hormones, circulation, brain function, mental health, and lifestyle habits. Modern lifestyle has created multiple hidden threats, including poor diet, obesity, stress, lack of sleep, alcohol, smoking, environmental toxins, sedentary habits, and mental health issues. Each of these factors alone can reduce testosterone and performance, but combined, they accelerate decline and can make men feel weak and unmotivated. The key takeaway is that male strength is not just about age or destiny. It is strongly influenced by choices, environment, and habits. Science confirms that reversing many of these factors, eating healthy, exercising, sleeping well, managing stress, avoiding alcohol and smoking, and correcting vitamin deficiencies, can restore strength, confidence, and sexual performance, even in older men. Understanding the hidden causes is the first step. Without awareness, men unknowingly weaken themselves over years, blaming fate or aging. But with knowledge and consistent effort, male sexual strength can be preserved and even improved. Understanding male sexual strength is only half the battle. Once we know what weakens it, the next step is learning how modern lifestyle choices silently destroy it and what can be done to restore it. The habits we consider normal today are often the main reasons why men experience early fatigue, low libido, and reduced performance. One of the most common lifestyle factors is excessive screen time. Hours spent on phones, computers, and television not only reduce physical activity but also disrupt hormone production. Blue light exposure late at night interferes with melatonin, the sleep hormone, which indirectly affects testosterone production. Research in sleep medicine shows that men exposed to artificial light at night produce less testosterone and sleep poorly, which further reduces sexual stamina. Overuse of digital devices also causes mental fatigue, stress, and even porn addiction, which can desensitize sexual response over time. Nutrition plays a pivotal role in male sexual strength. Diets high in refined sugar, fast food, fried items, and low in protein or healthy fats compromise testosterone production and blood flow. Omega-3 fatty acids, found in fatty fish, flax seeds, and walnuts, support heart health and circulation, which is crucial for erectile function. A deficiency in these nutrients reduces nitric oxide availability in the blood vessels, leading to weaker erections. Studies published in Nutrition and Metabolism show that men with diets rich in healthy fats and proteins maintain higher testosterone and stronger sexual performance compared to men on processed diets. Hydration is often underestimated. Even mild dehydration affects blood volume, circulation, and energy levels, all of which are critical for sexual performance. Men who fail to drink enough water experience fatigue and reduced stamina, even if they are otherwise healthy. Electrolytes, such as magnesium, potassium, and sodium, are essential for nerve signaling and muscle contraction, including the muscles involved in sexual activity. Research in the Journal of Applied Physiology highlights the importance of hydration and electrolytes for maintaining endurance and physical performance. Physical activity is one of the most powerful tools to maintain male sexual strength. Regular exercise, particularly strength training and cardiovascular workouts, naturally boosts testosterone, improves blood flow, and enhances mood. Resistance training stimulates muscle growth and hormonal health, while aerobic exercises like running or cycling improve heart health, circulation, and stamina. A meta-analysis published in Sports Medicine confirms that men who exercise regularly have higher testosterone levels, improved erectile function, and better overall sexual performance than sedentary men. Even short daily sessions of high-intensity interval training can produce measurable improvements in hormonal levels and endurance. Stress management is equally critical. Chronic stress raises cortisol, the stress hormone, which suppresses testosterone, disrupts blood sugar, and negatively affects sexual desire. Men under prolonged stress may experience fatigue, poor concentration, and erectile issues. Simple stress management techniques, such as meditation, deep breathing exercises, yoga, and mindfulness, can significantly reduce cortisol levels. Studies in psychoneuroendocrinology report that men practicing daily stress reduction techniques show improvements in testosterone and libido within weeks. Sleep is the third pillar of male strength. Quality sleep regulates hormones, repairs tissues, and improves mental clarity. Men who sleep less than 6 hours per night often experience low testosterone, reduced energy, and diminished sexual performance. Sleep apnea, a condition where breathing is interrupted during sleep, further reduces testosterone and can cause erectile dysfunction. Research in the Journal of Clinical Sleep Medicine confirms that men with regular sleep patterns have higher testosterone levels and better sexual stamina compared to sleep-deprived men. Alcohol and smoking are two lifestyle habits that directly reduce male strength. Alcohol decreases testosterone, increases estrogen, damages the liver, and weakens erections. Even moderate daily consumption can have measurable effects on hormone levels and performance. Smoking damages blood vessels, reduces nitric oxide, and decreases oxygen delivery to tissues, which is essential for sustaining erections. Men who quit smoking and reduce alcohol intake show significant improvements in sexual performance and hormone balance, according to research in andrology and alcohol research journals. Mental health is another crucial aspect. Anxiety, depression, low confidence, and emotional stress reduce sexual desire and performance, even if hormones are normal. Modern pressures, work stress, financial concerns, relationship issues, exacerbate these problems. Studies in the International Journal of Impotence Research show that psychological stress alone can reduce sexual performance by up to 40%. Therapy, counseling, and cognitive behavioral techniques can improve mental resilience and restore sexual confidence. Certain supplements and vitamins also play a scientifically supported role in male sexual strength. Zinc, magnesium, vitamin D, and vitamin B12 are critical for testosterone production, energy metabolism, and sperm quality. Deficiencies in these nutrients lead to low libido, fatigue, and reduced performance. Research in Nutrients Journal shows that supplementation in deficient men restores testosterone, energy, and sexual function. Natural herbal supplements like ashwagandha, fenugreek, and maca root have also been studied for their effects on testosterone and libido. Clinical trials confirm that men taking standardized doses show improved sexual desire, stamina, and hormonal balance without adverse effects. Environmental factors are often ignored but are highly influential. Exposure to endocrine-disrupting chemicals found in plastics, pesticides, and personal care products can mimic estrogen in the body, reducing testosterone and harming sperm health. Heavy metals like lead and mercury also negatively affect hormonal balance and sexual function. Environmental Health Perspectives reports that men exposed to high levels of these toxins exhibit significantly lower testosterone and higher estrogen, leading to decreased sexual strength. Modern sedentary work contributes to hidden weakness. Prolonged sitting compresses the pelvic region, reduces circulation to essential reproductive organs, and weakens muscles involved in sexual activity. Men who stand, stretch, and perform short daily exercises to target the pelvic region maintain stronger sexual function. Kegel exercises, traditionally recommended for women, also strengthen male pelvic muscles, improve erectile function, and enhance stamina. Clinical studies confirm that men performing regular pelvic floor exercises experience better control, stronger erections, and improved sexual endurance. Obesity, particularly abdominal obesity, has a cascading effect on male sexual strength. Fat tissue produces aromatase, which converts testosterone into estrogen. This hormonal imbalance reduces libido, weakens erections, and contributes to fatigue. Even small reductions in weight can improve testosterone levels, according to research published in the Journal of Obesity. Combining diet, exercise, and targeted strength training can reverse this effect. Chronic inflammation, caused by diet, lifestyle, or illness, damages blood vessels and nerves critical for sexual performance. Inflammation is linked to erectile dysfunction and poor stamina. Anti-inflammatory diets, including vegetables, fruits, nuts, and omega-3 fatty acids, along with regular exercise, can reduce inflammation and restore blood flow. The American Heart Association reports that erectile dysfunction is often an early warning sign of cardiovascular disease, emphasizing the link between vascular health and male strength. Modern work and sleep patterns, poor nutrition, environmental toxins, stress, and lack of physical activity create a perfect storm that silently weakens male sexual strength over years. Even young men are not immune. Scientific evidence shows that testosterone levels, libido, stamina, and overall sexual performance are declining globally, and the contributing factors are largely lifestyle-driven. The good news is that reversal is possible. By addressing diet, exercise, sleep, stress, mental health, and environmental exposure, men can restore energy, confidence, and sexual performance naturally. Understanding these factors is the first step. Awareness allows men to identify which habits are harming them most. Ignoring the signs leads to gradual decline, fatigue, reduced stamina, and low confidence. Early intervention can prevent serious long-term consequences, including hormonal disorders, erectile dysfunction, and low fertility. A holistic approach combining nutrition, exercise, sleep, stress management, environmental awareness, and mental health care is scientifically proven to restore male sexual strength. Lifestyle modification is not optional, it is essential. Scientific studies consistently show that men adopting a comprehensive plan experience measurable improvements in sexual desire, hormonal balance, stamina, and performance within months. This proves that male sexual strength is not fixed. It can be improved, enhanced, and maintained through conscious effort and informed choices. In conclusion, the decline in male sexual strength is not mysterious or inevitable. It is caused by a combination of poor nutrition, sedentary habits, stress, lack of sleep, substance abuse, environmental toxins, and mental health issues. Scientific research confirms that these factors directly reduce testosterone, weaken circulation, damage nerves, and impair brain function. Understanding these causes empowers men to make changes that restore strength, stamina, and confidence. The key is awareness, consistency, and evidence-based lifestyle adjustments. Restoring male sexual strength is entirely possible, even if it has been declining for years. Science proves that with the right combination of nutrition, exercise, sleep, stress management, and lifestyle adjustments, men can regain stamina, libido, and hormonal balance naturally. The first step is understanding the foods that directly support testosterone production and overall male health. Nutrient-dense foods are essential because hormones, energy, and sexual performance are all dependent on proper nutrition. Protein-rich foods such as lean meats, eggs, and dairy provide the building blocks for muscle, energy, and hormone production. Eggs, in particular, contain cholesterol, which is the raw material for testosterone synthesis. Fatty fish like salmon, mackerel, and sardines provide omega-3 fatty acids, which improve blood flow, reduce inflammation, and support heart and brain health. Healthy fats from olive oil, nuts, seeds, and avocado are critical because low-fat diets reduce testosterone production. Studies published in the American Journal of Clinical Nutrition confirm that diets rich in healthy fats are associated with higher testosterone and better sexual performance. Zinc is one of the most important minerals for male sexual health. It regulates testosterone, sperm production, and overall reproductive function. Foods rich in zinc include oysters, beef, pumpkin seeds, and legumes. Magnesium also plays a key role in energy metabolism and hormone regulation. Green leafy vegetables, nuts, and whole grains are excellent sources of magnesium. Vitamin D deficiency is common among men and is strongly linked to low testosterone. Sun exposure is the natural way to boost vitamin D, but supplementation is often necessary in modern lifestyles. Studies in Nutrients Journal show that correcting vitamin D deficiency improves testosterone, energy, and sexual function. Hydration cannot be ignored. Water ensures proper blood circulation, optimal metabolism, and nervous system signaling. Even mild dehydration can reduce energy, stamina, and sexual performance. Electrolyte balance, including magnesium, potassium, and sodium, is essential for maintaining nerve signaling and muscle contractions, which directly affect sexual strength and endurance. Scientific research in the Journal of Applied Physiology highlights how proper hydration improves energy levels, stamina, and performance in men. Exercise is one of the most powerful natural boosters of male sexual strength. Both strength training and cardiovascular workouts are essential. Resistance training, such as weightlifting, stimulates testosterone production and builds muscle mass. Larger muscles require more testosterone to maintain, creating a positive feedback loop that improves overall hormonal balance. Aerobic exercise, like running, swimming, or cycling, improves blood circulation and heart health, which is crucial for sustaining erections. High-intensity interval training (HIIT) has also been shown to increase testosterone and improve insulin sensitivity. Studies in sports medicine confirm that men who maintain regular exercise routines have higher testosterone, stronger erections, and improved sexual stamina compared to sedentary men. Pelvic floor exercises are specifically effective in improving male sexual function. Kegel exercises strengthen the muscles involved in erection and ejaculation, leading to better control, stronger erections, and enhanced stamina. Clinical studies show that men who perform regular pelvic exercises experience measurable improvements in sexual performance, even when age or health issues have reduced strength previously. Combining resistance training, aerobic exercise, and pelvic exercises creates the most effective routine for restoring male strength. Sleep is the foundation for hormonal health. Quality sleep regulates testosterone, repairs muscles, restores energy, and improves mental clarity. Men who consistently sleep less than 6 hours per night experience lower testosterone, reduced libido, and weaker stamina. Sleep disorders such as sleep apnea are strongly associated with erectile dysfunction and low energy. Studies in the Journal of Clinical Sleep Medicine demonstrate that improving sleep quality significantly increases testosterone and sexual performance. Creating a sleep-friendly environment, avoiding late-night screens, and maintaining consistent sleep schedules are simple yet effective strategies. Stress management is critical for restoring male sexual strength. Chronic stress increases cortisol, which suppresses testosterone, damages blood vessels, and reduces sexual desire. Practices like meditation, deep breathing, yoga, and mindfulness have been scientifically shown to reduce cortisol, improve mood, and restore hormone balance. Psychoneuroendocrinology research confirms that men who manage stress effectively experience increased testosterone, libido, and sexual performance. Combining stress management with regular exercise and proper nutrition creates a powerful synergy for restoring strength. Avoiding alcohol and tobacco is essential. Alcohol reduces testosterone, increases estrogen, damages the liver, and weakens erections. Even moderate alcohol use can suppress hormone production and reduce sexual stamina. Smoking reduces nitric oxide in blood vessels, damages circulation, and negatively affects erectile function. Quitting smoking and reducing alcohol consumption improve hormone levels, circulation, and stamina, according to research in andrology and alcohol research journals. Over time, men experience measurable improvements in sexual performance after lifestyle modification. Mental health plays an equally important role. Anxiety, depression, relationship problems, and low confidence significantly reduce sexual desire and performance. Even with optimal hormones and physical health, a man under chronic mental stress may experience erectile issues. Therapy, counseling, and cognitive behavioral techniques can improve resilience, reduce anxiety, and restore confidence. Studies in the International Journal of Impotence Research indicate that addressing psychological factors enhances sexual performance in over 40% of men experiencing dysfunction. Supplements can provide additional support when used wisely. Ashwagandha has been shown to reduce stress, improve testosterone, and enhance sexual performance. Fenugreek can boost libido and support hormone balance. Maca root has been studied for its ability to increase sexual desire and stamina. Clinical trials confirm that standardized doses of these natural supplements improve sexual function without harmful side effects. It is essential, however, to use scientifically validated dosages and avoid unregulated products that may contain harmful substances. Environmental awareness is often overlooked but critical. Men should avoid prolonged exposure to endocrine-disrupting chemicals found in plastics, pesticides, and personal care products. Heavy metals such as lead, mercury, and cadmium can reduce testosterone and harm sperm quality. Reducing exposure to these toxins, eating organic foods when possible, and using clean personal care products can support hormone balance and sexual health. Studies in environmental health perspectives demonstrate that men exposed to fewer toxins maintain higher testosterone levels and better sexual performance. Maintaining a healthy weight is crucial. Excess body fat, particularly around the abdomen, converts testosterone into estrogen, leading to hormonal imbalance, reduced libido, and weaker erections. Even modest weight loss through diet and exercise improves testosterone, energy, and stamina. Research in the Journal of Obesity confirms that men who achieve a healthy weight experience improved sexual performance and hormonal balance. Consistency is key. Single efforts such as exercising for one day or taking a supplement occasionally are not enough. Restoration of male sexual strength requires a holistic, sustained approach combining diet, exercise, sleep, stress management, mental health care, supplementation, hydration, and environmental awareness. Men who adopt this approach consistently experience measurable improvements in energy, libido, erections, and overall confidence within weeks to months. Lifestyle is the foundation, but daily routines reinforce strength. Morning routines that include sun exposure, light exercise, protein-rich breakfast, and stress management set the tone for hormonal balance throughout the day. Avoiding late-night heavy meals, alcohol, and screens protects sleep quality and testosterone production. Integrating short bursts of physical activity, hydration, and deep breathing throughout the day maintains energy and circulation. Modern science also emphasizes the role of brain health in sexual performance. Neurotransmitters like dopamine and serotonin regulate desire, pleasure, and satisfaction. Diets rich in antioxidants, omega-3 fatty acids, and vitamins support brain health and improve libido. Mental stimulation, meaningful social interactions, and reducing screen addiction enhance dopamine signaling, which directly influences sexual motivation and performance. In addition to daily habits, medical evaluation can help identify hidden issues. Routine checkups, hormone level testing, and addressing conditions like diabetes, high blood pressure, or sleep apnea can prevent further decline and accelerate restoration. Clinical research indicates that men who actively monitor and manage their health experience significantly better sexual outcomes compared to those who ignore symptoms. In conclusion, male sexual strength is not a matter of luck or inevitable decline. It is strongly influenced by nutrition, exercise, sleep, stress, mental health, lifestyle habits, environmental factors, and regular medical care. Scientific studies consistently show that men who adopt a comprehensive, evidence-based approach experience measurable improvements in testosterone, libido, stamina, and overall sexual performance. Awareness, consistency, and science-backed strategies are the keys to maintaining and restoring male strength at any age. The ultimate message is clear. Male sexual strength can be preserved, enhanced, and restored naturally. By understanding the hidden threats, making informed choices, and following a holistic routine, men can regain confidence, energy, and vitality. Strength, stamina, and sexual health are not fixed. They are living systems that respond to care, attention, and scientifically proven habits. With commitment and knowledge, every man can take control of his sexual health and enjoy a stronger, healthier, and more fulfilling life.